बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम। मैं हूं नादिया बशीर, आपकी मेज़बान FM 102.2 रिफा रिहैब शो से। सामीन, वर्ल्ड स्ट्रोक डे 29 अक्टूबर को मनाया जाता है और इसी सिलसिले में हमने कुछ एपिसोड्स FM रिहैब की शो की जो हैं वो स्ट्रोक डे को डेडिकेट कर रहे हैं। आज हम बात करेंगे कि पेशेंट्स के साथ फिजियोथेरेपिस्ट का क्या रोल है और वो कैसे काम करते हैं। हमारे साथ इस मौजू पर बात करने के लिए डॉक्टर मोहम्मद अशरफ मौजूद हैं, जो कि हमारे से इस मौजू पे डिस्कशन करेंगे। हर साल इस दिन को मनाया जाता है और इसकी जो इम्पोर्टेंस है वो रिकग्नाइज की जाती है कि स्ट्रोक पेशेंट्स के क्या सिम्टम्स हैं या early symptoms हैं that they should watch out from, how they should seek immediate medical care, how they should support their recovery. Stroke can affect movement, speech, um, and daily independence, but there is a hope for them. Physiotherapy also plays a very important role in helping stroke survivors regain their strength, balance, mobility, and empowering them to rebuilding confidence and independence in their everyday lives. Today, we're going to be discussing, how a physiotherapist can make a real-world difference in stroke recovery and long-term quality of life. Today, our special guest is Mohamad Ashraf bin Adzhar, and he's joining us from International Islamic University, all the way from Malaysia. Let's welcome him to our show and ask him first to introduce himself to our audience. Assalamu alaikum.
Waalaikumsalam warahmatullah. Assalamualaikum everyone. Yes, my name is Muhammad Ashraf bin Adzhar, and usually people will call me Ashraf, right? And as Dr. Nadia mentioned earlier, I am from International Islamic University, located in Malaysia, and I am one of the lecturer in the Department of Physical Rehabilitation Science. And for today's session, what we're going to do, Dr. Nadia, today?
Okay, so we're going to be asking you questions to explain to us, like, what is the importance of, stroke patients, how you being a physiotherapist can help them out. So let me begin
Yes.
the session by asking you the first question. Could you explain to us what stroke is and how it can affect our physical self or the body?
Okay, actually, a stroke can be happen when the blood supply that goes to the brain are interrupted or reduced. When it interrupted or reduced, it will prevent the brain tissue from receiving any oxygen or nutrient. Okay, without oxygen, the brain cell will die within few minutes only. And actually, the stroke has two main types. The first one we call it ischemic attack or ischemic stroke. The second one is hemorrhagic stroke. What are the difference between these two? Ischemic stroke actually caused by the blockage of the blood vessel, or we call it an artery that's supplying to the brain. And this is the most common type of stroke. The second one is hemorrhagic stroke. Is different from ischemic. Hemorrhagic stroke caused by a blood vessel in the brain, they are burst or leaking that leading to bleeding in the brain. And besides of these two main types of stroke, there's actually a mini stroke. Mini stroke, or we call it as TIA, transient ischemic attack. Although the mini stroke is not as bad as ischemic or hemorrhagic stroke, but it is still a series of warning signs. You still need to go to the doctor and then need to resolve some things. Maybe you need to eat some medication to prevent for the large stroke to happen to you. Okay. So actually, if you want to know the fast response to the stroke, if you notice somebody that having a stroke, there's actually a symptom to it. We call it FAST test. FAST, whereby the first one is F. F is the face dropping. You will notice the person will have a one side of face dropping. Okay. The second one is arm weakness, and one side that the face dropping is also the arm is affected and it's difficult in raising one arm. That's what we call the arm weakness. And the third one is speech difficulty. The speech becomes slurred. or strange, and you couldn't understand what the person is saying. And the last one is T, FAST. T is time to call for emergency services. Once you notice these three signs that happen to a person, all right, so you need to call for a stroke. You need to call for a doctor in medical emergency to act fast. And how it affects the body, usually stroke will affect one side of the body, starting from the face until the leg. Only one side is happening. Yes.
Okay, so you just explained to us some of the symptoms that the people should look out for, or the caregiver should look out for. Now, coming to the role of the physiotherapist. So, why is a physiotherapist considered an important part of stroke rehabilitation?
Well, the physiotherapy is playing a major role, major essential part in stroke rehabilitation, because when you are having a stroke, when a person having a stroke, they cause a motor weakness. What does it mean by motor weakness? Your arm and then your leg, some part of your body are getting weak. That's number one. The second one could be spasticity. After a prolong of stroke, it could be spasticity. Spasticity, which means that your body, your arm, is rigid in one place. The third one is a poor coordination. Poor coordination, which means that you are unable to stand by yourself. And when there is poor coordination, you will having a difficulty to walk, as well as balance problem. All right, so why physiotherapy is important? Because physiotherapy usually targeted the movement and task-specific training to promote neuroplasticity. What does it mean by neuroplasticity? Neuroplasticity is the ability of the brain to reorganize and form new neural connection, right, after the injury. When a stroke happened, the cell around it has died. So neuroplasticity comes in with physiotherapy, whereby it created a new neural pathway. And well, in addition to that, it also improves mobility and balance. One of, Actually, physiotherapy is one of the main intervention that you need to do when a person having a stroke.
So, how soon do you think that after a stroke should a physiotherapist be ideally, should start?
Well, okay. So this is a very good question. Some people will wonder, how soon can we start a physiotherapy session? Because as we all know, physiotherapy session it could be a long session and could be tiring, is it? And then for a stroke patient, how soon it could be? Actually, when a person or a stroke survivor are medically stable, they can start as early as 1 or 2 days after the stroke. But remember, after the person is medically stable, we need to check for the vital signs and everything, with all the medication and everything. After 1 to 2 days, after it's been cleared by the doctor, we can immediately start the physiotherapy. Because of why? Because what I mentioned before is we want to tackle the neuroplasticity, right? Because in stroke rehabilitation, we have what we call it as a golden period and golden hour. What is golden hour? Actually, golden hour is tackled by the doctors. Okay, how? Okay, for the golden hour, if you go to see the doctor, if you bring the person to see the doctor, because you see the FAST, you react on it, and the doctor will give you the tissue plasminogen activator, right? And this is a clot busting drug, right? Or mechanical thrombectomy. They will remove the thrombus from the brain, right? That's golden hour. Forgive me. The golden period is actually 1 to 3 months, and from the day 1 to 3 months after a person is having a stroke, right? This is a golden period. You need to do a robust physiotherapy session, probably twice per day for every day, maybe 1 day off, something like that. All right. Yes.
Okay, so what role does physiotherapy play in improving the balance and the coordination for stroke survivors?
Okay, for improving balance and coordination, first we need to understand what the causes of imbalance. Usually the stroke. A stroke will affect the motor. And when it affects the motor, the muscle are getting weaker. So muscle weakness coming in, lost coordination, and also impact proprioception. Proprioception is a body sense. Our body sense to stand up, our body sense to walk, as well as delay motor response. That are the causes of the imbalance. Okay, so physiotherapy role to improve it. First, physiotherapy will do some assessment and also intervention. And now I want to talk about the intervention a little bit. The intervention will be started with the static balance. And the static balance can be start from sitting, and then we can progress to standing. We start from there, right? Static balance, and also if the static balance is passed, we need to move to dynamic balance. And again, I want to say that, I want to emphasize that we need to start from sitting to standing. Okay, static balance, dynamic balance, and we can do the rehabilitation with the aids of we can do rehabilitation with the aids of tools such as a mirror therapy. You do the balance with the mirror in front of the person or the balance board. All right. And now the new emerging technology you can do with VR, virtual reality. And the much fun way is through Wii box. You can play, but you need to be aware. The Wii box can be played after the patient achieving the dynamic balance from sitting to standing. And also, we can do mat activities, basic task activities, and repetition movement per day. There are a lot of things. Okay.
So, how soon can a patient start to notice, or the caregiver can start to notice improvement in their, therapeutic sessions, such sessions?
Again?
How soon, positive symptoms, or you can see that the patient is improving after they had a stroke?
Okay, right. How soon can you notice a symptom is improving? Actually,
Yes.
there's no specific timeline actually
Okay.
for you to see how the
Mm-hmm.
improvement is there, but it depends on the severity of the stroke.
Mm-hmm.
Number one, and more importantly, the location of the stroke happens in the brain. Which location,
Exactly.
right? And the
Mm-hmm.
number two will be the you know, but well, I want to say that importantly, the location of the stroke happens, but
Mm-hmm.
satisfactory movement or improvement you can be seen from 3 months onward. And the small improvement you can see around 1 to 2 weeks. Some people, this is the earliest you can see through physiotherapy. From 1 to 2 weeks, you can see a small improvement, and you can see the satisfactory improvement from 3 months onward.
Okay.
Right. And remember, this is not a proper timeline, right? So
It
for a
varies
stroke
from
survivor,
patient to patient, right?
yes, it's varied from one patient to patient. Exactly. Yes.
Okay. So, what is the role of a family caregiver or an attendant in the recovery of the stroke patient?
All right. This is one thing. This is a very good one question, because I want to emphasize to the people out there, whereby the family or the caregiver
Mm,
should play a bigger support role, or the bigger support system to the stroke survivor.
mhm,
Why? Because number one, if because the rehabilitation can be happen faster, the improvement can be happen faster if the family or the caregiver are helping the person. Usually, okay, let me tell one scenario. A stroke survivor, all right, are receiving a treatment in the hospital for around 2 weeks, let's say 2 weeks.
mhm,
After discharge from the hospital, after the person is out from the hospital and get home, they will be given the outpatient. Usually, the stroke survivor, will be given the outpatient appointment for
mhm,
physiotherapy session. But at home, what are the at home, what are the person can be doing at
mhm,
home? Is it to stay, to stay alone, just pop up some medication and then just relax? No. Family and caregiver can do what the physiotherapist has teach in the hospital and can practice at home. All right.
Okay.
If possible, family and caregiver always be by the patient's side. This is a sacrifice that once need to be done, and then to remind them about exercises and help in fulfilling the daily needs. And after the physio session, and the carer can help to continue to give support what the patient needs. Okay, and then for some cases, the patient still need an assurance. Probably because of the patient is active, pre-morbid, active before getting a stroke, and after stroke, nothing much can do. So they need some assurance, for their health testing. Yeah.
Okay, so you just mentioned right now that most of the patients after stroke, they're not that mobile the way they used to be before, and they might need a support. Yeah, so what about the question that comes in my mind is that do you think a physiotherapist can help, by offering counseling or an emotional well-being support to the patient that has just suffered from stroke? How can a physiotherapist help such a patient?
Well, certainly, physiotherapy also can help with the emotional well-being,
Uh-huh.
because regular physiotherapy helps stroke survivor rebuild a sense control over their body and daily activities, through the exercises and through the treatment.
Mhm,
And this brings confidence and
mhm,
self-efficacy. Self-efficacy means that the person believe that they can achieve the goal.
mhm,
So in this part, physiotherapists and the patient need to work together. All
mhm,
right, need to work together to achieve confidence and
mhm,
self-efficacy, as I mentioned before. And also physical activity that the patient do
mhm,
also can reduce anxiety and depression. There's a study to it, because of what? Simple word, we can say that through physical activity, the depot the serotonin or the dopamine will be released. So it also can help in reducing
mhm.
anxiety and also depression.
Okay, so beside physiotherapy, what lifestyle changes do you recommend for patients after the stroke?
After the stroke, what
Mhm,
stroke survivor can do? Number one is to set a new priority. You are
mhm,
having a new life, a new lifestyle. All right. Yes, I understand. Some people, most of the stroke survivor wanted to be like before they get a stroke, right?
mhm,
But this is a different lifestyle. This is a different case, all right? You have moved from A lifestyle to B lifestyle. So the
mhm,
number one is you need to set a new priority, right? You need to eat the medicines, following the doctor recommendation. This is very important. I don't want to list out. I wanted to to explain more about the medicines
mhm,
because it's very long, right? But what I want to emphasize is to eat medicines following doctor recommendation. That's number one. It's very important. And you need sleep and rest. Don't stress too much. I understand.
mhm,
Mental well-being will affect stroke rehabilitation. Stroke survivor, right? So the caregiver need to play an
mhm,
important role to give assurance to them, right? Okay, number two is prioritize sleep
mhm,
and rest. Number three, if you're smoking, you need to quit smoking immediately, right?
mhm,
And you need to cut off the unhealthy eating habits. You need to start to eat
mhm,
healthy. And of course, number four is the most important one. You need to prioritize your rehabilitation and exercises, even though you don't like it, even though it's tiring for you, all right? Even though it's you are not enjoying it, but a good physiotherapist will do good to you. So bear with them, right? And prioritize your rehabilitation exercise. By then you have an optimistic goal, and then you can move from one goal to another goal to another goal. Yes, there's a lifestyle changes that you need to do.
Okay, so I had just one question again in my mind. Like I'm sure a lot of stroke patients are out there listening to our conversation. Is there
Mhm.
any chance or a probability that they can return to their previous life, the way they were before they had a stroke?
Okay, to the stroke survivors out there,
Uh-huh.
it's a hard thing to swallow, But well, for you to be returning to the normal life or normal
Uh-huh.
living condition actually is quite impossible. Yeah, most stroke survivors don't return to their old normal, but instead
Mhm.
you need to find meaning and a satisfactory in a new normal condition. Like I said,
Mhm.
your lifestyle is moving from lifestyle A to lifestyle B. So you need to learn to adapt a new normal. How to achieve it, the new normal lifestyle. This involving to you need to accept the changes, abilities that you are having. All right. You need to redefining your identity and
Mhm.
purpose. Number two. Number three, you need to build a new routine for yourself. And then
Mhm.
you need to find another source of enjoyment. If you are a sport person and you can't play your sport, you need to find another source of enjoyment. All right. That's one simple example. The number three is embracing support networks. Please accept support networks they are giving to you. All right. Because as I said, this is your new normal life. All right, you can make fun out of it actually. All right, and embrace your support networks. Even though we try our best to restore your body function, all right, for you to walk, for you to use your hand again, for you to eat normally again, all right. But to be like a pre-stroke life sometimes achievable, depending on the severity of the stroke, all right. But in most cases we actually teach the patient to adapt with their new normal life.
New normal, exactly.
Yeah.
So, what advice would you give to the stroke survivors who maybe feel little discouraged sometime or may feel little low during this whole rehabilitation process?
Okay. For stroke survivors out there, if you are listening to me, trust me, I understand the reason why you feel discouraged. It could be due to the long process and unsatisfactory rehabilitation, or it could be anything. It could be you cannot do the activities that you have done before, right? What you need to do is you need to set new goals. Please set goals, all right? And set your pathway. Don't focus so much on why it happened because
Mhm.
it had happened, right? Unfortunately, and focus on becoming better, right? Because you are a survivor. That's why we call it a stroke survivor. You are a survivor, all right? Act like one. Set goals, and please believe that what God has taken, what Allah has taken from us, surely He will repay you tenfold. All right, and I want to do exercise in group if there are support group that are available in your area or in the hospital, do exercise in group. If not available, you can ask for help to be in the group because it's much fun that way, and you can you can feel courage by seeing your friends doing activity all together
Mhm.
with you.
So, Dr. Ashraf, due to the shortage of time, we're coming towards the end of the program. And before
Right.
we, end the show, I would like you to share a message with our stroke survivors out there who are listening to us. Why is it important for their family to be part of the physiotherapy, and how important it is for themselves to be more consistent toward this new regime that they have to adapt after the changes. So, any take home message that you would like to give to them?
Well, what I want to say is that this is a take home message for you. That for stroke survivor, recovering from a stroke is a journey, right? It's up to you to make it fun or to make it not fun, But it's a journey that takes time.
Mhm.
Remember, it takes time, patience, and teamwork. Uh, these three things you need to embed yourself, a new normal. life. All right. And physiotherapy is one of the most powerful tools to help you to recover. All right. Remember, and physiotherapy goes beyond the physical. We also can help with your emotional well-being. Because each session will confidence, motivation, and also hope with the help of physiotherapists. A good physiotherapist will be able to tackle all these things to you, right? And it helps survivor, the stroke survivor, to regain your trust in your body and rediscover again the sense of your body control. And for family or caregivers, all right, your encouragement makes a tremendous difference. Okay, believe me or not, if you there are difference between the stroke survivor that are having all-time support and not support at all. You need to give encourage, because it makes a very huge difference. Yep. And supporting a consistent physiotherapy session, most importantly, and celebrating small achievement. Okay, to encourage the stroke survivor to go further. All right. And finally, I want to say that yes, a stroke changes life, but the recovery is possible.
Thank you so much for joining us all the way from Malaysia and taking your time out and discussing with us such an important, topic with us. Thank you once
Yeah,
again on behalf of Riphah Rehab Show.
Yeah, you are welcome. I hope from the question and the answers that I have given are helping you out there.
Yes, थैंक यू सो मच वंस अगेन सामीन,
Uh,
जैसे कि आप सुन रहे थे कि डॉक्टर अशरफ ने बताया कि कैसे स्ट्रोक के पेशेंट्स जो हैं वो मुख्तलिफ मरहल से गुजरते हैं सेशंस के दौरान। मैं उम्मीद करती हूँ कि ये प्रोग्राम आपके लिए मुफीद साबित होगा। अगले हफ्ते हम फिर मिलेंगे एक नए मेहमान के साथ, एक नए मौजू के साथ। तब तक मुझे इजाज़त दीजिए। अल्लाह आपका हामी और नासिर हो। अल्लाह हाफिज़।